Yeah, back at it. Quick update. Merry post-Christmas and almost Happy New Year to all of you that are watching this. So far so good. Today is December 28th. So I am, what would that be? 38 days? Almost 6 weeks post-surgery. Surgery was November 20th. Last couple weeks, last week and this week, today's Thursday, pretty amazing. Pain has been a 0 to a 1. I am walking every day that it's not raining out here, which is most days, but I'm knocking out 3,500 steps on my walk. My days end up anywhere between 4,000 and 7,000 steps, a little bit over what the surgeon and I agreed to, but I feel great. The endorphin release from going for a walk is very similar to what I get when I used to run, and I know that'll temper with time, particularly as I start walking more. Coming up next week is third, have my follow-up meeting with the surgeon, which will maybe my release date to start driving, and I'll be released to physical therapy. Looking forward to physical therapy. I have put on 30 of the 40 pounds that I lost early last year, and so I'm feeling it. Not freaking out. A lot, sort of maybe. Not freaking out because I'll get into PT. I am aware PT is probably going to quash the joy of that 0 to 1 on the pain scale over the last couple of weeks, but that's fine. It'll be good. It'll be a good pain. Get everything, start stretching out. I am wearing my abdominal brace when I'm walking, but I find that I don't really need it much. It's gotten to the point where my core seems pain's limited and the core strong enough that it's actually, I don't want to say uncomfortable, but maybe a little uncomfortable to wear. Just walking around the house. So I wear it when I do my walks. Really don't wear it around the house. Certainly don't wear it when I'm sitting or laying down or anything like that. Sleeping wise, have a pillow for underneath my knees. That is a must. Sleep number bed has been a lifesaver. Sleeping on my side now for the last few weeks, and everything's feeling really good. I still have so I still have a couple of things, and I know that these are going to take time, but I have at my surgical site, like in the center of my back, or just kind of off center, I have a patch that feels probably about this big that is still dead numb around the incision site, and that's pretty normal. It was a big incision. It was pulled open for however long it took to, for a couple of hours that it took to do the surgery. No real pain anymore from my back. I'm still on Tylenol and gabapentin, and November 3rd I should be put on my taper dose for gabapentin. So we'll see how that goes. And then I am taking Robaxin, just one at night to sleep. And I will probably, I'll talk to the surgeon about that on the 3rd, but probably discontinue that on the 3rd. And we'll see about the Tylenol. It'll be interesting to see about Tylenol because Tylenol's never really done anything for me. I've always taken ibuprofen for things like body aches and headaches, and that works very well. But ibuprofen has some contradictory effects on bone grafts, so they tell you not to take it for quite some time, 6, 9 months, maybe even a year before you can start taking it again. Just like smoking, smoking significantly degrades bone grafts from healing or grafting, and just alcohol. Plus, you shouldn't be drinking alcohol with gabapentin. So, yeah, not doing any of those things. And which is tough because I have a whiskey room upstairs, Scotch room, and I smoke a pipe and cigars. Not tough at all. So Scotch is medicinal. Take none of this as medical advice. Yeah. So healing fast, feels fast for me. Walking well. Certainly don't need my walker, barely need my brace, walking 3,500 steps at a clip I just got back actually from my walk this morning and feel great. So next update will be probably this weekend, or certainly I'll have an update from my doctor's appointment from the 3rd to confirm or deny that I was released to start driving again. Please, God. And to PT, which would be nice. So, more to follow for all you guys that are watching and going through this, or are interested in this, or have been watching this and you have some of the issues that I have that were corrected by this surgery. By all means, put your comments in. I read comments and I will answer them. And for as much non-medical but experiential advice as I can provide. And for all of you that are going through this, I hope you heal well. I hope you heal fast and get back on your feet. So take care.